Good morning. My name is Devin Ashbridge, Public Information Officer with Lane County. Normally today we would have our elected officials here to provide an update, but we were unable to work out the scheduling today. Unfortunately, our leaders will return and they remain just as committed to providing information and supporting our community as they have been through the whole process. But today I will just provide a few updates on our current situation. We have listed on our data page 78 positive cases, 1 presumptive case. 64 people have recovered, which again means they've gone 72 hours or longer without symptoms and without the aid of medication. We've had 3 COVID-related deaths in Lane County. There are currently 12 active cases with 10 people who are resting and recovering at home while 2 are hospitalized. We will be seeing an additional case, our 79th positive, show up on that data page later today. The new case is a person in their 40s from the Eugene-Springfield area who is resting at home. This is an epilink to a known case and is an example of household transmission. We've been getting a lot of questions this morning about whether Lane County has been approved to enter phase 2 under the state's plan. We haven't yet received word, so certainly we'll be sharing that information, as will our media partners far and wide, once we do hear from the state, and we believe that will happen sometime today. We did hear from Governor Brown yesterday about some of the markers that the state will be using to make decisions about whether or not to approve phase 2 applications for counties. Lane County has seen an increase in cases over the last 7 days, which is one of the markers that the state looks at. I think it's important that we contextualize those cases and have a better understanding of why we're seeing an increase. The majority of the cases identified were asymptomatic and identified through proactive sentinel testing. So a lot of these folks are people who may not have chosen to seek medical care because they weren't symptomatic. They didn't realize that they had COVID-19 and could have been spreading it. So it ultimately means an uptick in cases in the short term, but in the long term, it gives us an opportunity to work with those folks and the people that they've been in contact with to have them quarantined, to have them limit their contact so that we can limit ultimately the spread of the virus. We would be concerned about the uptick in cases at a higher level if we were seeing cases in different parts of the county that were unrelated, because that could be a sign that we have multiple hotspots in the county. And right now what we're seeing is a cluster of cases that continues to be related and have epilinks among the different patients. The work around contact tracing, sentinel testing, case identification that public health is doing is working. Again, we've said all along, once we're able to begin this type of testing, we will find more cases. So we want to make sure people are aware this was expected, and it's ultimately going to help us keep that case count lower over the long term in our community. It also means that because many of our cases are linked in examples of household transmission or have direct epilinks to known cases, that we can better understand how the disease is spreading and can work to slow it down. We also announced yesterday our first pediatric case, and we just want to let people know that the child is doing well so far, is at home, had few contacts outside their family over the last few weeks, and is being closely monitored. We've also heard some rumors of unreported COVID-19 hospitalizations in Lane County, and we wanted just to remind folks that it's not only Lane County residents that seek care at our hospitals. We're lucky to have 2 large hospitals right in our community here, but they do draw patients from other areas around our state. And so while I don't have specific information, some of the base of that rumor may be if patients from other counties are seeking care or being treated here locally, they would not be counted as Lane County cases. So just a reminder that our hospitals draw people from far and wide for treatment. I would like to provide a brief update on the rent assistance program that we talked about on Tuesday. The application opened yesterday at 10 a.m. Within the first 10 minutes, we had more than 250 applications. And by the end of the day yesterday, we had a total of 938 people submit eligibility applications. I think it goes to show us and just underscore the need that exists in our community. And so over the next couple of weeks, the folks that filled out that eligibility application and were found to be eligible will be contacted by a partner agency in the community to finish filling out the full application. So we'll move forward in that process. We're also continuing to advocate and are in close contact with our state representatives and legislators so that they understand the need in Lane County, and as they're looking at how they can provide support, our hope is that we continue to receive funding to support rent assistance programs. And so as we learn more about that, we'll share that information. I mentioned on Tuesday as well that we're gearing up to offer energy assistance funds to the community. So I'll share a little bit more detail about that today. We've been provided $575,000 in federal funding to assist with energy costs. The funding is known as LP20 CARES, and it's intended to assist households who've been affected by COVID-19, either through loss of income or due to health. And it's separate from pre-existing energy assistance programs. So for people that have received or participated in an energy assistance program earlier this year, including LIHEAP, they are eligible to apply for this funding as well. It is completely separate, so we don't want anyone who may be eligible to miss out on applying for these funds due to a misunderstanding. The program provides qualifying households with a one-time payment toward either electricity, natural gas, home heating oil, propane, wood pellets, and wood. And it will provide a one-time payment that ranges between $250 and $550. The payment totals based on a number of factors for each individual recipient. To qualify for the LP20 CARES program, a household's current gross monthly income must be at or below 60% of Oregon's median income. So for example, a household of four could have a gross monthly income of up to $4,163. There's a lot more information regarding eligibility requirements online. The wait list for this funding will open on Monday, June 8th at 9 a.m. And we really encourage people who think they may be eligible and are interested in the program to visit www.lanecounty.org/LIHEAP CARES, LIHEAP CARES, to get information on that program and bookmark that page so that they can put themselves on the waiting list once that becomes available on Monday. I'll take questions from the media now.
Stephanie Rothman has several questions about the fairgrounds. When did the money run out? Which shelters are coding besides the fairgrounds?
So Stephanie Rothman with KMTR has a couple of questions regarding our respite centers. The first two are about reasons for closure and what sites are closing. So Lane County had opened 2 respite centers in response to COVID-19 for unsheltered members of our community. They were intended to be a short-term emergency response, and as we continue to see things open back up and some services begin to come back online, we are working toward closing those respite shelters and focusing on long-term permanent solutions for housing in our community. So the sites that are closing that have been opened as those short-term emergency respite centers are the Expo Hall at the Lane County Events Center in Eugene, and then we had a site in the Memorial Building in Springfield as well. The last count that I had available, we had a total of 61 guests between both facilities. We have outreach folks visiting to see what resources we might be able to connect people with. And we are also working closely with our partners at the City of Eugene and the City of Springfield to start looking at vacant or underused properties in both cities in the metro area, to see what we can potentially provide as safe places for people to sleep. It's certainly not a simple problem to solve, but we are committed to finding solutions and working with our partners to do so.
Also from Stephanie, is the county concerned they'll cause damage or take over property?
Stephanie other question was whether there is concern that individuals will damage property. I assume she means as people are transitioning out of the respite centers. We're going to work with each individual. It's, again, been a long-term problem in our community, and the solutions to homelessness and getting people housed and sheltered are complex, but our commitment remains high. It's been part of the long-term work we were doing prior to COVID-19, and it remains part of our most important and critical work.
Tiffany Eckert with KLCC News also has some questions about the respite shelters closing. Is the plan still to close them tomorrow, even with the increased case count? And what shelter options is the county providing for individuals who have exited?
So Tiffany with KLCC had some follow-up questions to that. The first was, are the respite sites still slated to close tomorrow? Yes, the respite locations will close tomorrow, June 5th. During the day, and we will help people transition out of that. I believe her second question was, what are we connecting them to? We're working with community partners to see what is available, especially for safe housing. I will remind Tiffany and folks that we have seen an uptick in cases, but we have yet to see a positive test result in a member of our unsheltered community. And so we will continue, as we know that's a community that is vulnerable, to monitor via testing.
Tiffany has one follow-up. Have you considered the timing on shelter closures given the curfew and street protests?
Tiffany's question is, have we considered the timing on closure of the respite centers in light of curfews and street protests? The planning for these centers has been in process for several weeks at this point. I also haven't seen the curfew reenacted in the city in the last few days, so certainly while we're aware of what's happening within our community, it was not a factor in the planning around this. Are there any other questions? All right, those are all the questions. Thank you very much.